Better Public Services Strategy provides a framework for us in healthcare in relation to how we innovate, implement and improve our public services. I think it gives us an overall framework alongside Sláintecare in how we can engage in the different policies and strategies that we have in health in order to improve and develop and transform, in some cases, our public services. The Department of Health developed a policy with the HSE which was adopted by government. This was called Digital for Care Ireland 2030, and that set out 6 principal areas of focus. Firstly, patients. What can we empower patients? What can we put in their hands to ensure that we as the public can interact with the health system the way we can with lots of other retailer, other providers and other government bodies? And what can we also provide in relation to things like virtual care, interactive messaging and so on, that will provide things into people's hands that will make their lives easier and allow them to interact with the health system. The second is around care management systems and electronic systems, and this is a huge area for us in relation to maybe our diagnostic systems, around laboratories, imaging, where we've done a huge amount of work, and this year we'll roll out the last 3 hospitals our national imaging system, and at that point every hospital in the country, all of their images will be electronic, all in one system and available for use and access right across the country, irrespective of where we as patients turn up. But there's a raft of other programmes and solutions that we're looking to deploy: our electronic health record, our shared care record, systems into our community services, and some of our specialist areas such as finance and HR, where we're rolling out solutions as well. The third area then is around innovation and health ecosystem. There's a huge range of companies in Ireland and indeed in the EU and the UK who've developed lots of innovations and ideas, and we want to improve how we work with them. So the bigger solutions tend to work with larger companies by their nature. We also want to look at ensuring we continue to create this health ecosystem with small providers, small industry, both in Ireland, within the EU, and indeed across the water in the UK as well. The fourth is ultimately our infrastructure. Again, implementing solutions. If you don't have Wi-Fi, if you don't have the right technology to use in the ward, if you don't have the right technology that you can use as a public health nurse out visiting someone in the west of Ireland, we need to make sure that infrastructure is there, and that requires a substantial investment to upgrade the infrastructure and then to maintain it at that level. The next area then is in relation to data and analytics, and this is really powerful. We need data. It's vital in terms of standards and clarity, distinction in terms of notations, standard terminology for pharmacy, for laboratories, for radiology, for coding. All of those things are really important. So being clear on what standards we're using for our data, how we're going to deploy them, how we assess the services. Are they actually performing well? Are they actually ensuring that they're using those standards and applying them? And if they're not, why not? And what can be done to support them? The analytics area, we have a massive amount of data. We're always under pressure in our health system. Demand is always greater than what we can cope with. Waiting lists, as we know, are always challenging, and while we're making inroads into some of those areas, we know the demographic of our population is going to see more and more demand on our health services, and that data analytics is vital to help us to plan how we can cope with that in a better way. And lastly in that area is the area of artificial intelligence and automation. We've created a centre of excellence. They've done huge work in the last couple of years. We've saved over 750,000 hours of time by releasing people to do more high value and work that's more focused on patients than repetitive tasks, and we believe there's a lot more scope in that. And artificial intelligence opens up all sorts of possibilities in relation to how we can improve how we deliver healthcare. The other area then is in relation to our workforce and workplace, where effectively we're looking at putting in systems, and we're well advanced with solutions in relation to our financial management, our resource management. We're often challenged in healthcare about how we use the resources in our system by government, by other government departments, by the public, and rightly so, that we can account for every cent that we spent. And those investments will help us to manage the workforce better. Also looking at rostering tools, how we can support making sure we have the right staff in the right place at the right time, rather than relying on manual solutions. So across those 6 areas, we have a range of initiatives that are being developed. The plan runs up till 2030, and our aim is to try and accelerate all of those now over the next number of years so that we can deliver a better health service by putting those solutions in place. More benefits for patients, more benefits for staff, improved access, higher quality, but also more efficiency in how we use the resources that we have. I think there's a couple of key things that we've learned, and other parts of government have been very successful. Areas like revenue, for example, we know have been very successful. It's creating a single point of access for the public, for all of us, in relation to our tax services. Our experience, and my own personal experience, has been leadership is key, in terms of trying to drive that change, not just at that national level, but in the case of healthcare, right down to the regions and to the hospitals on the ground. And in our case, perhaps unlike other areas, clinical leadership is vital in relation to transformation, because their services are all about clinical services in the main. We have social services as well, so when I use the term clinical, it's sort of service leadership and people stepping up and being prepared to take on that in terms of trying to take it through. A clear direction, a clear sense of timing, a clear sense of pace, and ultimately been clear on what's the value, what are the objectives that you're trying to achieve. We'll often have very detailed business cases or processes require us to have that level of robustness to how we run these big programs. It's public money, we're obliged to do that. But I think in terms of success, we need to draw out from that what are the things that if you were explaining that to the patient or to the staff that would make the biggest difference, and that keeping your eye on that as you keep working through the challenges you face will help to keep your target on that goal. One of the key areas is the patient app. So we've launched it just before Christmas in 2024, and there'll be a wider public launch early in 25. It's focused initially on things like the European health insurance cards and the various cards that people may have. It's focused on giving people information about access to services, allowing them to get trusted information, which was a big thing when we did studies with the public. So we've built this with patients. We haven't done this in a dark room. We've had patients involved directly, and we've consulted with various patient groups around it as well. It will be an evolving piece. We intend to have 4 releases every year. So we will, as we build up the foundational systems, that means your lab results are now on the new national lab system, that we have electronic health records in place, we've improved data coming through perhaps from our GP systems and so on. We'll be able to give more information to patients through the app, but also ultimately to allow patients to interact, because that's what we need. If I want to change my appointment, I can do that for lots of services at the moment. You can't do that in healthcare. We have so many systems at the back, that a lot of them are so old. We need to move to streamline those systems to allow the app to actually talk to those systems, change the patient's appointment, find when the next appointment is available, give the patients the options. And the app is also leveraging the MyGov ID, which is really important because that's the trusted source. People know that is the access point across government, that they can trust that. And from our own research, that proved to be really important to the public. One, that there's a trusted point of access to my data, that you know it's me that's accessing it. And 2, that it is the HSE, and that means we can trust that information because it's our public health system. So we've lots of exciting ideas, but it will require investment in the app, but also in the systems that underpin our health service and those big programs that I mentioned earlier. For me, design is at the heart of this. We build health systems, we have ways of working, we have clinical guidance, we have policies, we have procedures. They're there to enable staff to work in what can be very complex environments, dealing with many different types of patients and services. As we introduce technology, we need to use that design thinking to see how can we do this differently. And we need to use those approaches so that the technology isn't being implemented on old, outdated policies or ways of working, and that we orientate people. Our Spark programme has done a huge amount of work on this to build up a network of people who have that capacity and capability. So when we bring these large investments, these solutions along that will ultimately we want to roll out throughout the entire health system into every hospital or every community in the country, that there are people there with that thinking which can look and see, well, how can we do this differently? How can we make better use of that investment? And that's both at a national level as we design national pathways and guidance, but also at a local level, because maybe the way the service is configured in North Dublin will be slightly different to Inishowen and Donegal. And it's going to also be important in innovation, where we're looking at new ways of doing things. I mentioned artificial intelligence earlier and some of these other areas where there's new technology. We're seeing a convergence now between what would have been called the old IT or the PC and medical devices. They're much in the same now. You walk into a hospital, you can't really differentiate. Most medical devices have a computer built into them. Many of them have artificial intelligence built into them. There's a lot of potential in terms of looking with design thinking and innovation, also at national level in terms of how we approach these new pathways and new programs and how we make sure we design them most effectively. And then at local level, leaving people tolerance to make that difference between maybe the way they're going to run the service in Inishowen and the inner city in North Dublin.